Hi guys, my name is Mackenzie Carlson, and I am currently practicing dental hygiene at Glacier Community Health Center in Cupping, Montana. I have been here for around 5 years and have been in the dental program, or the dental field, I guess I should say, for probably around 9 years. I was a dental assistant before I went to hygiene school, and then after hygiene school have been here for practicing at Glacier Community Health Center for the last 5 years. So Glacier Community Health Center is located in Cupping, Montana, which is a really small rural area of Montana. We have about 3,000 people as our total population here in Cupping. Cupping is probably about 20 miles-ish from Browning, Montana, which is home to the Blackfoot Indian Reservation. The Blackfoot Indian Reservation is spread a little bit around Browning, but they have around 10,000 people spread between Browning and Babb and East Glacier and our super rural area. Cupping is around, I'd say about 130 miles from the nearest bigger community like Great Falls or Kalispell, which have a Walmart, so we're a ways from any shopping or stores or things like that. So Cupping is super blessed to have the community health center that I currently practice for and serve and meet the needs of the community. Working in Cupping and working for the community health center has provided me with a lot of great outreach opportunities. I love my job because we are able to go into schools and help those kiddos and work a little bit with the community at all the health events and the health fairs, and go to Browning and work with them a little bit. Browning does have an Indian Health Services facility there where they do have a big dental clinic, but since COVID, their dental services have been shut down for the last couple years. So our little community health center in Cupping has been flooded with patients of all ages and all needs, and people that need, routine treatment, and then also a ton of people with emergencies. So our little clinic has just been stressed out and bombarded in this period of time with the need for more help. The majority of our dental assistants here at Glacier Community Health Center have received on-the-job training and taken their radiation health and safety examination because that's needed here in Montana. But most of our dental assistants haven't, been to any courses or received any training or certification beyond what they've learned in our clinic. Most of our dental assistants are super comfortable treating children because we have a ton in the office. We do quite a bit of outreach to the school systems and families. We even pop over to the medical clinic if we have time to do fluoride varnishes at some of their appointments, just so we try not to miss any of the kiddos in our community. With it being a pretty low income area, a lot of the kiddos don't see a dentist, or we don't have any fluoride in our water, so need a little bit of extra help with the caries management, whether that's just oral care instructions or whatever we can do to help. But our dental assistants don't have a lot of training with geriatric patient population, and Cupping and Glacier County and the surrounding area has a very large geriatric patient base. We actually just recently added palliative care, where a lot of our doctors and providers will go to different people's homes that can't travel to the clinic to receive their care, and dental is in the works of kind of being added to those trips, to help people out. So having a little bit of training and knowing a little bit better how to help these patients will be huge for our dental assistants. So I'm planning to do my learning practicum at Glacier Community Health Center's medical clinic in the basement. They have a big conference room that already has a big projector and stuff all set up. And I'm hoping to do it at the beginning of March at our strategic planning staff meeting. And I want to kick it off by greeting everyone, all the dental assistants that are attending the presentation, giving them some handouts, just chit-chatting a little bit to make everyone feel comfortable. I then want to start with kind of a story about how I wasn't super comfortable. I mean, a patient is a patient, and as a dental assistant, I was just kind of quiet and shy, but I did not have any geriatric patient, training or care, and I was a little bit uncomfortable. And sometimes I was uncomfortable as a dental assistant because I didn't know how to make them comfortable. I sometimes knew that they weren't comfortable in the dental chair, but are they not comfortable because they hate the dentist or because they're having lower back pain and I didn't know to give them, some help or support or a little pillow back there, there's just little things like that if you don't know your options and know what to watch for, you're just not as comfortable as a provider. So I'm really hoping that through my PowerPoint presentation, which will be next after I tell a little story about my experience in going into the nursing home as a dental assistant and just getting really comfortable with that patient group, I'm going to kick into the PowerPoint presentation where I'll talk about, medication concerns and, what medications can cause, dry mouth and extra caries through that, and talk a little bit about periodontal disease and different health considerations that go along with that. And I'll also talk a little bit about dental treatment concerns and what you want to watch for with different, treatments. If someone has had a knee replacement, maybe they don't want to lay it completely flat and you can pop the little neck pillow under their knee. Or a lot of our little elderly ladies are really cold in our dental clinic, so giving them a blanket or things like that will help out. And throughout the PowerPoint presentation, I'm going to have little active learning questions to ask to keep them engaged and going and keep the juices flowing up there. And just at those times, if anyone has any questions, they can pop in and ask them or anything like that. So after the PowerPoint presentation, I'm going to have some case study slides, and I'll have an example case study that I go through first with a patient and some of their meds and some concerns, and then I'll just have some questions afterwards. So I'm going to have the dental assistants get into little small groups, and those little small groups can then go work through the questions, kind of do some active learning together, and then after they have a chance to go through those questions together, we'll come together as a group. And I will have brought all of the aids that we have in our clinic, whether it be Prevident for dry mouth or different kinds of interproximal brushes for perio or chlorhexidine mouth rinse, our pillows, our blankets, different floss threaders, denture cleaning brushes. I'll bring a bunch of those aids downstairs so that when we're going through those case studies together, they can actively learn too. And one of the questions will be like, which aid would you select to talk to this patient about to help them use it at home? And why did you select this aid? And just different things to keep them going and hopefully help some things kick in to make them a little bit more comfortable with geriatric patient care. And then I really want them to go back into the clinic, practice for a couple weeks, and then I want to send an email with a little evaluation or get together with the dental director and talk to her a little bit about if she thinks that the learning practicum helped and what areas she can see them excelling at, or if there are any areas that I need to change, like do I need to add a different section or tweak a section, or did they not really get a lot out of like the medical concerns? Are we still struggling with different medications that have different reactions? So I want to get her feedback so that I can monitor the learning practicum a little bit, because I think it'll be really useful. And especially as employee turnovers come, just getting everyone really comfortable with the geriatric patient population and help serve our community a little bit better. Thank you.